Hi, my name's Lisa Harvey Vince and I'm a member of the Public Health team at Surrey County Council. Public Health provides a supporting role to frontline services. So for example, at Surrey County Council we've been working with children's services and education, particularly with the schools, the preschools and the universities as they've all come back. Adult social care services, we've also been given infection controls advice to care homes and looking at visitor policies for them. We work with our communications team to ensure that there's clear public health messages going out through multimedia channels. And we work with our legal services, particularly as new legal powers were given to local councils. We work with the emergency management teams to make sure that things like events are COVID secure. And also when we were doing a lot of welfare work for food and medicines and people who were shielding, we worked to give them advice then. We're currently working with our customer services team to put in place local contact tracing, which hopefully will come soon. We've been working with our district and borough environmental health teams, particularly with outbreak investigations. And again, we developed a checklist to help them assess the events against COVID secure arrangements that need to be in place. They've also been working with the homeless and we work with them to help secure accommodation and help with self-isolation and giving advice. We work with our health partners, so for example Public Health England to do with outbreak management, and also our GPs in terms of getting alert messages out to patients when case numbers are rising in the area. We're working with hospitals and community trusts, and particularly around testing programs for COVID-19, and now that what will be coming online will be mass vaccination as well. We also work with our non-health partners such as the police and the fire environment agency. An example at the beginning of the pandemic was to do with PPE, and everybody needed to have it and there was a limited supply, so how are we going to prioritise? We've also been working with our surrounding county councils. For example, we've all had to produce local outbreak control plans, and within these plans are escalation frameworks which show what services need to do as the local case numbers start to rise. And we also look at our daily monitoring of the data, and this helps us inform what communications need to go out to local residents and businesses, what testing we need to put into the area, and how we work with partners particularly. The best bit about the job has been working with a vast number of dedicated, tireless professionals, where over the last 8 months everyone has been running a marathon at a sprint speed. A surprising fact about our job is really about how all partners have come to realise that public health can support and enhance the valuable work that they do every day by connecting people, ideas and looking at the evidence.